Hello, my name is Susanna. I'm a founder at HarvestCare, which is a mission-driven organization which works on bridging regenerative agriculture with healthcare in Europe. Today, I would like to guide you through our shortened theory of change of our organization. The challenge we are working on is focusing on the fact that food is currently not part of the conventional healthcare system. At the same time, nutritional density and the broader quality of our food is undervalued and mostly unrecognized, leading to perversive incentives for both farmers and consumers, as well as significant missed opportunity for our health system. The main challenge here is to ensure that the connection between soil health and human health are widely embraced and connected to practical changes in our health and food system. So how does the HarvestCare works then on solving this challenge? Inputs of our organization focus on collecting the research and comprehending the research of soil health and human health nexus. We are utilizing the nutritionist knowledge and nutritional science. We are building broad partnerships with regenerative food supply chain actors. We are having very strong partnerships with academic institutions on both nutrient density side and healthcare side, as well as local NGOs. And we are part of the Teaching Kitchen movement. The activities that HarvestCare organize focus on creating community-based preventative healthcare, creating regenerative teaching kitchens. In regenerative teaching kitchen, we are finding ways to create easy access to regenerative food for vulnerable communities. We are looking at creating nutrient density research. We are having group health programs which serve vulnerable communities and focus on culinary education, health education, and individual support. And we are producing a medical research that can prove the value of food as medicine. Our activities will lead to following outcomes. We want to focus on distributing nutritional density research, help farmers and health organizations to implement the connection between regenerative agriculture and healthcare, create accessible teaching kitchen programs within local communities, create structural incentives for members of vulnerable communities to access healthy, affordable food, collaborate with insurance and doctors to refer patients to teaching kitchen programs, and make market access for regenerative organic farmers through HarvestCare supply chains and partners. We hope that following outputs will lead to shorter outcomes which focus on increasing knowledge among health professionals and EU citizens about human health and soil health connection, increase the interest in One Health concept among NGOs and governmental bodies, create long-lasting behavior change towards a healthy diet supported by the Teaching Kitchen program, and create teaching kitchen programs with regenerative food that will be part of incentive of health insurances. Those short-term outcomes will lead to our ultimate outcomes, which is nutrient-dense food will be broadly recognized, valuable, and accessible. A majority of agricultural land in Europe will be cultivated for human consumption using regenerative practices that prioritize soil health. And EU funding will prioritize preventative healthcare and development of knowledge, skills, and infrastructure that will ensure food and health justice among European citizens. Our vision is to have food and healthcare linked, and governments and farmers understanding the very strong connection and regularly include healthy, nutrient-dense food in health incentives and health interventions. We want every individual to be able to access regenerative teaching kitchen where they can have access to affordable, nutrient-dense food grown from agroecological approaches and healthy education workshop, as well as individual support for healthy professionals in the implementation of the new lifestyle. We also hope for farmers to begin to prioritize nutrient density and impact on human health due to the increasing incentives for such a produce as regenerative practices necessary to create them. And we aim for a broader shift which prioritizes holistic awareness in the citizens, incentivizing them to have a consistent interest in the contents of their food, as well as where and how it was grown. We hope that using food as an entry point, people will take a more proactive and preventive approach for the health and well-being. So this is the Fear of Change of HarvestCare. Thank you so much for listening, and I hope that you would like to learn more about it. Then please make sure to reach out to us, or if you would like to see our more in-depth Fear of Change, I'll be very happy to supply this to you. Have a wonderful day.